Okay, so we'll start with personality disorders, cluster A. Personality disorders are clustered into three categories based on the ways in which they are perceived to be similar. So, cluster A would be odd or eccentric disorders. When we get to cluster B, you're looking at dramatic, emotional, or erratic disorders. And when we get to cluster C, you're looking at anxious or fearful disorders. So, what are personality disorders? All right, so, like, for example, you could have somebody with an obsessive compulsive disorder, and you can have somebody with an obsessive compulsive personality disorder. These are not the same thing. Actually, they present quite differently. So, what a personality disorder is, first, it's not diagnosed until the age of 18. That is an arbitrary cutoff, and there are people that are treated for psychological personality disorders before the age of 18. But the question really becomes, at what point has your personality sort of established? So at what point is what we see like sort of your more pervasive personality? And it's not really clear where to cut that off. 18, it is arbitrary, but there are some developmental stages that you will already have gone through that makes 18 sort of make sense. But like I said, people get treated for, say, borderline personality disorder. There are plenty of people that get treated for that in high schools where they technically can't get the diagnosis for it yet. So, a personality disorder is a way of thinking, feeling, and behaving that deviates from the expectations of the culture, causes distress or problems functioning, and lasts over time. So, a few things. One, used to be considered an access to disorder, meaning that it's pervasive. So, if somebody has a personality disorder, we know that they are dealing with this for years potentially, depending on the severity. Could take up a good portion of their life, although there are also, depending on the personality disorder, some treatments that are more or less effective depending. But you've essentially, if you have a personality disorder, you're basically organizing your world as you're learning about stuff. You're organizing all of your information in a way that's maladaptive, in a way that doesn't make sense and doesn't fit in. So it's going to cause you a substantial amount of distress. So for whatever reason, you become sort of wired, if you will, in a neurological way to perceive things in a way that's not good for you. For the three personality disorders in cluster A, I do want to give you the gender male female breakdown of it because it depending on the disorder, it can vary quite a bit actually. So when you look at paranoid personality disorder, it's about 67% male, 33% female. For schizoid, it's about 78% male, 22% female. And for schizotypal, it's about 55% male and 45% female. So this cluster is more common in males than in females. As you see here, for paranoid personality disorder, you need 4 out of 7 of these things for diagnosis. But I think maybe before I go through them, I will read a case to you. I'm going to just read a brief little case from a textbook, actually, Abnormal Psychology, and that way, hopefully, it gives you a better picture of what this looks like. So here we go. Jake grew up in a middle-class neighborhood, and although he never got in serious trouble, he had a reputation in high school for arguing with teachers and classmates. After high school, he enrolled in the local community college, but flunked out after the first year. Jake's lack of success in school was in part attributable to his failure to take responsibility for his poor grades. He began to develop conspiracy theories about fellow students and professors, believing they worked together to see him fail. Jake bounced from job to job, each time complaining that his employer was spying on him while at work and at home. At age 25, and against his parents' wishes, he moved out of his parents' home to a small town out of state. Unfortunately, the letters Jake wrote home on a daily basis confirmed his parents' worst fears. He was becoming increasingly preoccupied with theories about people who were out to harm him. Jake spent enormous amounts of time on the computer exploring websites, and he developed an elaborate theory about how research had been performed on him in childhood. His letters home described his belief that researchers working with the CIA drugged him as a child and implanted something in his ear that emitted microwaves. These microwaves, he believed, were being used to cause him to develop cancer. Over a period of 2 years, he became increasingly preoccupied with this theory, writing letters to various authorities, trying to convince them he was being slowly killed. After threatening harm to some local college administrators, his parents were contacted and they brought him to a psychologist who diagnosed him with paranoid personality disorder and major depression. Now, right off the bat, I know that this may sound a little like schizophrenia to you, and it wouldn't actually be uncommon for somebody with this type of personality disorder to have schizophrenia later on, but the paranoid personality disorder would be there first. And as such, the risk factors are much higher if you have a family history of schizophrenia or another type of delusional disorder. So the symptoms of this disorder would not be happening during a psychotic episode in schizophrenia, bipolar disorder, or a depressive disorder with psychotic features. So going through the symptoms here, believes others are using, lying to, or harming them without apparent evidence, has doubts about the loyalty and trustworthiness of others, does not confide in others due to the belief that their confidence will be betrayed, interprets ambiguous or benign remarks as hurtful or threatening, holds grudges. In the absence of objective evidence, they believe their reputation or character are being assailed by others and will retaliate in some manner, is jealous and suspicious without cause that intimate partners are being unfaithful. When you put all of this together, you can have somebody that the slightest thing they will think it is like about them or somebody out to get them. So like, somebody is deceitful for whatever reason. They're doing it to harm you. It's not like they're doing it to get away with something or to, the social niceties that happen. No, they're out to get you. You have a dog that barks, and obviously the dog was barking in a deliberate attempt to annoy you. So your airline gets delayed, like you're supposed to fly and your flight is delayed. That's obviously a deliberate attempt to stop you from going somewhere or to get under your skin. Most people, if they were to voice that stuff, would recognize, all right, you know what, I'm probably overreacting. Like, even if it feels that way, it's probably not true. This is not going to happen with paranoid personality disorder. They will continue to interpret things as personal attacks, and it will also extend to the people in their lives, which is going to make meaningful relationships extremely difficult. I mean, I guess you can imagine how difficult of a life you would have if you were interacting with people and were never able to trust people. You were always suspicious of their motives or what they were going to do. It's a very isolating disorder. They take these suspicions out on people. They're argumentative, they might complain, or maybe be very quiet. But their hostility towards others is usually pretty apparent. They seem ready to pounce whenever there's been a perceived slight. And I don't know if you guys know that old Jim Morrison from The Doors, that song that he said, people are strange. The words, people are strange when you're a stranger, faces look ugly when you're alone. That's kind of the interpretation of people with this particular disorder. And you can also imagine trying to get treatment with this disorder. If you don't trust people, you're not likely to go and seek treatment. Usually, if they do seek treatment, it's because of some big problem in their lives, some crisis in their lives that's causing a lot of anxiety or depression. I'm hoping these cases are helpful. I'm going to use the same text, the abnormal psychology text, Barlow and Durand, to give you another case so that you can see what this is like. By the way, I think it's really important that you hear these cases because you list symptoms of this stuff sometimes, probably less so with the odd eccentric stuff, but some of the other disorders, you hear these symptoms and you're like, oh my God, that's me, that's somebody I know, or whatever. And if you see the case or do the movie project or whatever, you'll see that it's not the case, that you want to see what the picture actually is. So I'm going to read this to you. So this is a 39-year-old scientist was referred after his return from a tour of duty in Antarctica, where he had stopped cooperating with others, had withdrawn to his room, and begun drinking on his own. Mr. Z was orphaned at 4 years, raised by an aunt until 9, and subsequently looked after by an aloof housekeeper. At university, he excelled at physics, but chess was his only contact with others. Throughout his subsequent life, he made no close friends and engaged primarily in solitary activities. Until the tour of duty in Antarctica, he had been quite successful in his research work in physics. He was now some months after his return, drinking at least a bottle of schnapps each day, and his work had continued to deteriorate. He presented as self-contained and unobtrusive and was difficult to engage effectively. He was at a loss to explain his colleagues' anger at his aloofness in Antarctica and appeared indifferent to their opinion of him. He did not appear to require interpersonal relations, although he did complain of some tedium in his life and at one point during the interview became sad, expressing longing to go see his uncle in Germany, his only living relative. At the core of this personality disorder, you have somebody who is somehow defective in capacity for forming social relationships. They show this absence of warm feelings towards others. As you saw in the scenario, the guy seemed kind of baffled as to why people were getting upset with him. What I want you to notice about this disorder, schizoid, because there are some symptoms that may seem like another disorder. Like there's a disorder called avoidant personality disorder, and some of the behavior might overlap, but what you want to note here is that there's no actual interest in outside relationships, where somebody who's avoidant very much wants outside relationships and has trouble like getting them. Here, they don't even notice. They don't seem to even want them. So when they withdraw because they seem uninterested in others. So looking through the criteria, you need 4 out of 6. So the first one here, neither desires nor enjoys close relationships, including being part of a family. Almost always chooses solitary activities, except for in chess in the case, right? Has little, if any, interest in having sexual experiences with another person. Takes pleasure in few, if any, activities. Lacks close friends or confidants other than first-degree relatives. Appears indifferent to the praise or criticism of others. Shows emotional coldness, detachment, or flattened affectivity, which we talked about with schizophrenia, right? That not responding appropriately. So, like wearing that theater mask. So it's like, can't see what I'm thinking because my affect is flattened. So you don't get any sort of outward readout of their emotional response. Unfortunately, one of the things that is kind of prevalent among people with this personality disorder is homelessness. Perhaps it's due to their lack of close friendships, and they often don't even seem to be dissatisfied about not having, say, sexual relationships with another person. They don't even seem dissatisfied, although they could be. There's no readout of that from them. And when you compare this to paranoid personality disorders, this disorder seems to be a bit more extreme. They basically consider themselves to be observers of the world rather than participants in the world around them. And lastly, for schizotypal, you need 5 out of these 9 symptoms, but first let me give you the case of Mr. S. Mr. S was a 35-year-old chronically unemployed man who had been referred by a physician because of a vitamin deficiency. This was thought to have eventuated because Mr. S avoided any foods that, quote, could have been contaminated by machine. He had begun to develop alternative ideas about diet in his 20s and soon left his family and began to study an Eastern religion. Quote, it opened my third eye. Corruption is all about, he said. He now lived by himself on a small farm, attempting to grow his own food, bartering for items he could not grow himself. He spent his days and evenings researching the origins and mechanisms of food contamination, and because of this knowledge, had developed a small band who followed his ideas. He had never married and maintained little contact with family. Quote, I've never been close to my father. I'm a vegetarian, end quote. He said he intended to do an herbalism course to improve his diet before returning to his life on the farm. He had refused medication from the physician and became uneasy when the facts of his deficiency were discussed with him. For diagnosis, you need 5 out of the 9 symptoms. Starting with the first one, has ideas of reference, not including delusions of reference. So I don't know if you remember this from the schizophrenia slides. Remember, delusion is a false belief. Reference, you're kind of putting pieces, disparate things together, assigning personal meaning to them, acting like they connect. Remember, John Nash did that. He was breaking codes that he thought he saw. Ideas of reference are similar to delusions of reference, but they're not as strongly held as delusions of reference. So if somebody has a delusion, they often stick to the delusion despite evidence to the contrary. Somebody with an idea of reference, their mind can potentially be changed about that. All right. Next one, has strong beliefs or magical thinking that influences behavior. And that is quite different from subculture norms. So like feelings about superstition, generally bizarre fantasy. They also tend to have odd perceptual experiences, such as bodily illusions. So looking at, remember, not a hallucination, but sort of a misinterpretation of what they are seeing or feeling, that they often report feeling as though, say, somebody is present despite the fact that they are very much alone at the moment. And obviously you can distinguish that with schizophrenia, whereas somebody with schizotypal disorder would, feel that somebody is there. Somebody with schizophrenia would think somebody is there. They would potentially see somebody there or hear somebody there. Next, has strange thinking and speech habits, for example, excessively vague or excessively metaphorical, is excessively suspicious or paranoid, has inappropriate or restricted feelings that could be flattened affectivity or just completely inappropriate feelings, behaves in an odd or eccentric way, or has an odd or an unusual appearance, lacks a closeness with others except with first-degree relatives, and experiences excessive social anxiety even with the comfort of familiar people and places. This anxiety tends to relate to paranoid features rather than self-consciousness. Looking at kind of like childhood history with people that have this disorder, a lot of times I've noticed that children who develop this tend to be passive and disengaged when they are, when they are little, and they tend to be hypersensitive to criticism. Another interesting fact about this disorder is that there's a lot of misdiagnosis due to cultural reasons. So if you get somebody, we're able to look at religious rituals. So if you look at somebody who speaks in tongues or practices voodoo or mind reading, that sort of thing, that they can be so interested in that and so into it and so in some cases obsessed with it, that it makes them appear extremely unusual, and that leads to the misdiagnosis of this disorder.